This is Unit 1, Module 1, Lecture 1, Human Movement. The PowerPoint slides that you have on Blackboard cover the entire lecture. These video modules will be, this lecture will be broken down into smaller sections. So this is just covering planes of motion and some of the axis of rotation and basic introduction to muscle contraction. There'll be another video on muscle contraction and then another video on the biomechanics. So when we look at this unit, like I said, the biomechanics, we'll look at a little bit of the external and internal forces, but what we're really looking at is starting our descriptive terminology for how we describe movement, visualizing movement, and trying to categorize that into what plane of motion and what axis of rotation is occurring. In order to describe movement, everything has to be referred back to a reference point. And the anatomical position is the reference point that we use to describe all movement, regardless of what we're actually seeing. So if someone's about to throw a football, or is jumping, or performing a bench press or a squat, when we try to describe that movement, it is all referenced back to this position here, this anatomical position. This previous slide here, which you have, this is the text, the terminology that describes what's happening, but this is basically what you're seeing. So it's someone standing as tall as they can, arms and legs extended as straight as they can be, and the only odd thing are these palms facing forward. But this is how we describe movement. This is the reference point from where we describe movement. Before we even get into describing movement, we're going to describe just static positions. And in order to do that, we use terminology, again, as I mentioned in class, or will mention in class, that it's not a matter of sounding really smart or intelligent. It's just using verbiage or wording that is consistent with the industry. So when we talk about where something's at or where something is going, we have these anatomical directional terms. And you can see them listed here in pairs. These are the superior versus inferior, anterior versus posterior. I have another slide here that shows a visual representation of what's happening here. So this arrow here, when you talk about things that are moving upwards or things that are above, that's superior. Things that are moving downwards or things that are below, that's inferior. There's an imaginary line that divides the body right down the center, dividing into left and right halves. When you're moving towards that center or towards that midline, that's referred to as medial or medial movement. If you are away or moving away, that's lateral. This superior inferior is talking about moving higher, moving lower. When you start looking away from the torso and you get into the arms and legs, so the limbs, if you look at the fingers, hands, and the torso, if you're moving towards the torso, so from the fingers towards the torso, or from the toes towards the torso, that's moving proximal, you're moving closer. And if you're moving further away from the torso, either through the arm or through the leg, that's referred to as distal. And then if you're on the surface and you're moving in towards the center of the body, that's referred to as going deep or deep. And then if you are deep and moving out or coming more towards the surface, that's superficial. And then lastly, when we look over here on the left, when you're moving towards the front or in the front, that's referred to as anterior. If you are moving towards the rear or in the back, that's posterior. You'll see here in parentheses that another name for anterior and posterior is ventral and dorsal. So think of like dorsal fin, that's the back. Where this comes into play is when we start looking down, this is the anterior or the ventral surface. And we have this dorsal surface and this plantar surface. So dorsal is the back or top. So that's the only kind of confusing aspect, is that it's really referencing based on what you're facing or how the orientation of the foot is. So when we get into the foot out, we'll explain it more in detail, but if you imagine your foot in the orientation it is, this is the top, that's the bottom. The bottom is the plantar surface or the bottom of the foot, and the dorsal is the top of the foot, the dorsal surface. So anterior, posterior, front and back is the terminology you use. The only time you'll really use dorsal is when you start talking about the fin or the imaginary fin on the top of the shark or your foot there. So those are directional terms. We start to get into this aspect of dividing the body into this three-dimensional coordinate system. We use this to identify what joint action is occurring, what motion is occurring, where is occurring in space, and then the axis of rotation, so we can classify or develop and design exercise from that. So the three planes that exist in the body, the cardinal planes, are the sagittal plane, the frontal plane, and the transverse plane. So the sagittal plane, as you can see here, the red plane here divides the body in left and right halves. This frontal plane, that blue plane, divides the body into front and back halves, and the transverse plane, the green plane, divides the body into top and bottom. So that sagittal plane here, you can see just by itself, isolated, divides the body in left and right halves. What you see here, this dark line, is the axis of rotation. So that is, if movement is occurring in the sagittal plane, it is rotating about this axis. So we introduced, or will introduce, this concept of axis or axes in class. And an axis is nothing more than a hinge or a pivot point. So if you imagine a tire here spinning, that point is where that point there, that axis of rotation, is all this mass, all these things are spinning about that rotation. If you look at this hinge, you have your pin here, and then you have this metal and that metal, or in the human body, this joint and that bone, and you have this bone rotating, or this bone rotating about that axis there. So that's how all human movement, or how all joints and most movement in the human body functions. So it's a function of rotation, and the joints act as the hinges, and then the bones act as the levers that rotate about that hinge or that joint. So when we go back to the coordinate system, you have your sagittal plane here, and you have this axis of rotation. So if I were to take this image and rotate it 90 degrees, that axis, that hinge, would be here, and that wheel would be in this plane of motion here. So sagittal plane motion occurs through this medial lateral axis, and that axis goes left to right, or side to side, or medial lateral. The next few slides here introduce then the frontal plane, and that axis of rotation, that tire then would be parallel to the plane, and that hinge would be going, that axis would be going right through. And then same thing here with the transverse plane, divide the body in top and bottom halves. So we've talked about movement in the plane, and let me just jump to the slide here. This is what I was talking about, that human joint motion is rotary motion. So when you look at these, this is one limb, that's the other limb. There's the axis of rotation, in this case the elbow, and you'll see that it's this bone rotating, and you can see that it's creating this curved path here. And if I disconnected the elbow and just kept that axis there, or disconnected the humerus, I could spin it all the way around, and that would make a circle. All right, so this is the equivalent there, just that hinge, and that flex rotates and contracts within a particular range of motion. So even though the joint motion is rotary, our output, you can see here that the hand is starting here, and it's reaching for the glass of the cup. The output here is actual linear motion, so in a relatively straight line. So although we as humans can create linear motion, all these joints, this motion is coming from these three joints: the shoulder, the elbow, well, not necessarily the wrist, but the shoulder and the elbow, and the body's able to, rotating there, actually create a linear type motion. But it happened because of shoulder rotation and elbow rotation that produced that linear motion. So each plane has particular axis of rotation, and we describe the motion in that plane a little differently. And so here is my very technical drawing. You have your sagittal plane, which divides the body into left and right halves, and any movement that's occurring through that axis of rotation, because of the orientation of the plane, is either a forward and backwards movement or upwards and downward movement. So when you perform a squat, you are doing motion within the sagittal, not predominantly in the sagittal plane. And as we shared in class, that's usually referred to as flexion and extension. When you look at the frontal plane, this is all your side-to-side motion. So this is your abduction or lateral motion, lateral bending. And then if you have your transverse plane, this is twisting or spinning. So this is like twisting to your left, twisting to your right, or your arms and legs spinning inwardly or outwardly. So this is how we categorize that motion. And all of this is rotation, rotary motion, and there's a correlating axis of rotation that occurs for this. Skip down here. So when we start to describe our motion here, we are using these planes of motion, we use these axes of rotations as the point at which the joint or the motion is occurring on. And these axes of rotations are perpendicular to the plane, so perpendicular to 90 degrees. So these are the motions that occur. So you have the sagittal plane, frontal plane, and transverse plane. Flexion and extension is joint rotation that is occurring in the sagittal plane. Ab and abduction is joint rotation that is occurring in the frontal plane, and that rotation is the rotation or the spinning that's occurring in the transverse plane. So in the sagittal plane, the only two descriptive terms that exist are flexion or extension, and this is applicable to both the appendicular skeleton, the arms and legs, and the axial skeleton, the torso. So the definition of flexion is the decreased angle between two bones. Extension is the increased angle between two bones. Basically, if you're tucking yourself into a ball or achieving the fetal position, making yourself into a cannonball before you jump into the pool, that's flexion through the entire body. When you go to stand up and you stand up as tall as possible and stick your chest out and try to be as wide as possible, so your arms down by your sides and chest out, that's the definition of extension through the entire chain. So tucking yourself into the ball is flexion. The other way of looking at flexion too, at every joint except for the knee, is if the limbs are moving forward, so your shoulders going forward, your hips going forward, your arm going forward, your knee going forward, everything except for your foot going backwards is all flexion, and then the opposite direction is extension. Frontal plane motion. Remember, the frontal plane divides the body into front and back halves. So you have this, and then you also have this imaginary line, this midline that goes right down the center through your nose, belly button. Any motion that occurs in the frontal plane where the limb is moving towards midline, that's referred to as adduction, ADD. And anytime you take something away, you abduct it, that's abduction. And that's the terminology that you use for the arms and legs. For the torso, since the midline is basically the spine, and then if you start to lean away, like bend to your left or bend to your right, that midline starts to change. So it would be difficult to try to identify which is abduction and which is abduction. So instead of calling that ab and abduction, this is referred to as lateral flexion. And this is moving the spine away from midline. And that's either the cervical spine, the thoracic spine, or the lumbar spine, which are the different divisions of the spine. And then how you delineate between left or right is just by using left or right. So if you're bending to your left, that's left lateral flexion. If you're bending and the movement is going towards the right, that's right lateral flexion. So unlike the sagittal plane motion, flexion and extension are used to describe both arm and leg and spine motion. In the frontal plane, the arm and leg motion has different terminology than the torso. And that's also true for the transverse plane. In the transverse plane, the movement that's occurring here is a spinning movement or rotation. And if you're talking about the arms or legs, if you're turning towards midline, you're inwardly rotating or medially rotating because you're going towards the medial aspect or inward. That's internal rotation. If you are turning out, that's external rotation. So just like with the spine, you're neither turning towards midline or turning away from midline or inwards from midline when you're doing spinal motion, because you are rotating through the spine itself, which is the axis of rotation. So just like with lateral flexion, we just call this rotation, spinal rotation, and the way you separate is left rotation versus right rotation. So those are your six basic six motions that occur in the plane. There's 3 planes, 3 opposing motions, so 6 total motions. Terminology changes a little bit in the transverse and frontal plane when you're talking about spine versus limbs. There's this concept that's called Tri-Planar Motion. Depending upon which textbook, which specialist, or which researcher, or which discipline, physical therapy, occupational therapy, athletic training, personal training, are talking to, this Tri-Planar Motion can mean different things. In the context of this class, we're just going to introduce this concept, but you'll probably never ever really use this. Tri-planar motion in the context of this particular course, this particular lecture, is referred to as the circumduction. And basically it's this conical-like movement. So instead of having a fixed hinge and having a curvilinear path, your distal limb, so your hand or your foot, is making a circular type movement. Just as a tangent or reference point, triplanar motion can also mean some kind of movement that's outside of the cardinal planes. So if you look at like taking your arm and going across your body like a chop, or a golf swing where it's not quite the sagittal plane, not quite the frontal plane, but it's some oblique plane out in between. That's also sometimes referred to as triplanar motion. And then even others will describe triplanar motion as movement that's occurring in all three planes simultaneously, creating some aspect. So like this will be described a lot in the foot or the ankle. When you reach across your body, there could be other joint actions that are occurring. So again, it gets very convoluted and very complex, and depending upon who you're talking to. So triplanar motion, when you're exposed to this outside of this class, does not always mean just circumduction. For this class, though, is circumduction. I doubt very highly this will ever appear on a certification exam. It will not appear on any of my exams, just because there's so much confusion associated with this particular word. There are, however, some other special considerations in the body, particularly at the wrist, the scapula, and the foot. When you look at hand motion, wrist motion, which leads to output of the hand, when your palm is up, so hand is down when you're, this is called pronation. When your palm is up, this is called supination. This is technically internal rotation, and this is technically external rotation, but prone is usually as a face down position, supine is face up. So if you think of your hand as facing forward, remember from anatomical position, if it's face down, pronation, supination, the way I remember it, like I shared in class or will share in class, that if you're carrying a bowl of soup, as in supination, you hopefully have that upright. And if you pour, P for pronation, you're dumping that over. So as much training as I had, as much education as I had, I still use that mnemonic, or that, not mnemonic, but that image, that description to clarify supination and pronation, just always for confirmation. This you'll use quite often, dorsiflexion versus plantar flexion. The reason why there is a distinction or special consideration or special terminology for this is that the bone here comes straight through, and the definition of flexion is two segments getting closer together, and extension getting two segments getting further apart. Regardless if my toes come up or toes go down, depending upon how I look at this, I can say that these 2 points are getting closer together, but these 2 points are getting further apart, and vice versa. So you can see here, the heel got closer to the tibia, and the toes got further away. And then the opposite happened. So which one is flexion and which one is extension? So instead of trying to figure out who's flexion, who's extension, both of them are referred to as flexion. The only difference is that which surface got closer to the leg. You have your dorsal surface of your foot or your plantar surface of your foot. If your plantar surface got closer, we call that plantar flexion. That's represented right here. If your dorsal surface got closer, we call that dorsiflexion. That's represented right here. And then the last area that has some special considerations is the scapula, or the shoulder blade. Now the scapula moves about the thorax. So you have your rib cage here, and the scapula moves over that rib cage. That relationship, the scapula and the ribs, is not a true joint. There's no bony or connection there whatsoever. If you look closely here, what you can see, and we've shared or will share on the skeleton in class, that the scapula is connected to the clavicle, and the clavicle is connected to the sternum, and that's the first point of contact that the body, the scapula, actually has with any kind of structure. So this is not really a true joint, but we definitely recognize shoulder motion here all the time. And without getting into a huge functional anatomy lecture about shoulder mechanics, the primary function of the shoulder is to maintain a relationship with the arm, the humerus. You can see that relationship there, the bone. And it's meant to create stability. We have lots of mobility with our arm. We can put our arm in a whole bunch of different positions. We can put it behind our back, in front, over our head, down low. We can rotate it. We're free to do this because we don't walk on it. We don't load through it. So it's designed in a way that it doesn't bear as much weight. And so we have a lot of freedom and flexibility with it. With that mobility, we have to have a stable base that follows. And so the scapula moves with the humerus. So wherever the humerus goes, the scapula goes. And you can kind of see that here when this, in this cartoon here, this person is lifting their arms over the head. You can see that the humerus is going up, the scapula is going up. When the arms are coming down, the humerus is coming down, the scapula is going down. When the arms are coming back, the scapula are coming back. When the arms are going forward, so you see that wherever the arms go, the humerus follows. So this distinguishes just like we have 3 planes of motion and 3 movements, or 6 movements, we have 3 basic movements, 3 opposing movements, so 6 total movements here. So you have an upward and downward movement, you have a side-to-side movement, and you have a forward and back movement. So just like you would expect in the sagittal, frontal, and transverse plane. I'm going to go to the next slide here. This shows the up and down movement. So when you bring your shoulder up like a shrug, or when you mimic a body language saying you don't know, I don't know, you have a shrugging motion that's called scapular elevation. The return, or going deeper, is the depression. When you give yourself a hug, like bring your arms across your body, your arms are going forward, your shoulder blades are going forward, that is called retraction. If you open up your arms because you're going to give someone a hug, or bring your arms back, your arms or humerus are going back, your scapula is coming back, that's called scapular retraction. And then when you do a jumping jack, bring your arms up over your head, your humerus goes up, so does the scapula, so that's called upward rotation. So the face here of the scapula is rotating upward, and then the opening here that connects to the bone. And then when you bring your arms down or back behind you, that's called downward rotation. And then I think my next slide here shows kind of what that would look like. It's kind of showing some muscular involvement, but the elevation, here's your shrug, there's your depression, retraction, you're squeezing your shoulder blades together, and protraction, they're going forward. So that's it. That's all the available motion that occurs within the human body. Flexion, extension, ab and abduction, lateral flexion, trunk rotation, internal, external rotation, and then scapular movements, dorsiflexion, plantar flexion, and wrist motion. So that's it. So I'm just